In a moment, I'm going to introduce you to a new member of the criticalhealthnews.com team, Dr. Joanne Conaway. Her book is called Why is America So Sick? Very important subject matter. And, of course, criticalhealthnews.com is the website. The toll-free number to get you started is 1-855-949-RADIO. And we'll be back with Dr. Joanne Conaway next on Coast to Coast AM. Welcome back to Coast to Coast. Physicians have been mystified by chronic fatigue syndrome, a condition where normal exertion leads to debilitating fatigue that isn't alleviated by rest. There are no known triggers, and diagnosis requires lengthy tests administered by an expert. Now, for the first time, Cornell University researchers report they have identified biological markers of this disease in gut bacteria and inflammatory microbiology agents in the blood. They think that there's some connection here. Now it gives me a chance to introduce you to Dr. Joanne Conaway, serving 20 years in the U.S. Air Force and the Army Air Force Reserves. Dr. Conaway was an aerial medical evacuation nurse and in-flight medical crew director, now a practicing naturopathic physician. Dr. Conaway left mainstream medicine, rejecting the conventional approach of treating symptoms with pharmaceuticals. Her primary focus is the function of the gastrointestinal system. We'll get her to react to this story we just had, its role in overall health and how it specifically relates to immunity. Dr. Conaway believes very strongly that body, mind, and spirit, an approach to whatever you do for wellness is going to be paid off in a big way. And she's part of the criticalhealthnews.com team. She is an author. Her book is called Why is America So Sick? And I do want you to know again that the criticalhealthnews.com group, they are sponsors of the program, and we are partners with them. Joanne, welcome to the program. Good to talk with you.
Well, thank you so much, George. I'm delighted to be here.
God, there was...
And I think it's interesting what you just said about fibromyalgia. I can't wait to talk about that.
Oh, my gosh, yeah. And then we had a story last week, Doctor, that deaths by doctors, the third leading cause of death in the United States. That's frightening.
Oh, it's very frightening, but medical errors are on the rise, and there's a lot of reasons for that. We can talk about those things as well as we get into the program, but it is frightening, and part of the reason why I'm no longer a part of conventional medicine, if you will.
Were you frustrated with conventional medicine?
Oh, my gosh. Frustrated, I don't think is a strong enough word, and the reason was I saw what was happening to these patients day in and day out, because of the modalities being used, and I knew there was a better way. I was caught in conflict continuously, and that's why I had to retire from nursing early. I loved nursing. I loved patient care, and, going back 40 years, I loved the technology. I loved all the things we did, but as time progressed, I found that technology, all those medicines, all those things were far too much. What the body needed was the basic nutrition and the things that we talk about at Critical Health News, those important things that each and every one of us need as a human entity. Not the pharmaceuticals, not the technology, nutrition.
And in your book, Why is America So Sick?, you lay out reasons, of course, why this is such a disaster. Is this happening worldwide, or are we, as Americans, in the worse shape than other nations?
Well, we're in pretty bad shape, but it is really happening worldwide. Some of the other developed nations, you'd think it would be the underdeveloped nations that would be having so many issues, but it's not. It's the developed nations. And a big part of it has to do with, once again, technology, the way food has evolved and now is being processed and grown, and the genetically modified foods and all of those things, the way we've adulterated wheat and created such problems with gluten, and all of those things are actually seen worldwide. Now, some of the countries across the world are getting smart to this, and some countries are refusing to import some of our crops because they are genetically engineered or genetically modified. They are recognizing that there are issues and problems, and they're trying to slow it down and trying to stop it. In this country, for various reasons, and we can talk about those, we are not slowing it down. We are not stopping it, and in fact, it's getting worse. Doctor,
tell us a little bit more about yourself, and welcome to the team, by the way.
Well, thank you. I appreciate that. A little bit more about me. I was a nurse for 40 years, interestingly enough. I practiced conventional medicine for 40 years and decided that as I said a minute ago, I just couldn't handle the conflict anymore. And when I was first introduced to the concept of nutritional support, fascinatingly enough, it was back in the 1970s and early 80s. And this was when I worked as a nurse on a nutritional support team in a big teaching hospital in Texas. And during that time, we were first able to realize we could keep people alive that could no longer eat by mouth. We knew people needed carbohydrates and proteins. We quickly learned that people also had a need, the human body also had a need for essential fatty acids. But more specifically to the critical health news mantra, if you will, we found that people had a need for many minerals and trace minerals we were not aware of. It was fascinating because these were things that we had studied in school. We had seen them on the periodic table in the classroom. But the body had a need for things like molybdenum and manganese and selenium and boron and things that now are common names but were not back then. So for me, knowing that and having that basic knowledge, when I first was introduced to Dr. Wallach and first introduced to the Dead Doctors Don't Lie CD, I got very excited because everything he was talking about I had seen in the clinical setting. I had seen the manifestations of these mineral deficiency diseases in these people who could no longer get the minerals they needed because they could no longer eat by mouth. So for me, it was a no-brainer. I jumped on board right away. I knew that this is where I needed to be, and I've been with Doc now for almost 18 years, and it's because I have been able to help more people in the last 18 years than I ever helped in 40
That's great.
years.
It's got to be satisfying to be able to do that. I know, Joanne, when I go to conventions and people come up to me and they go, thank you for criticalhealthnews.com. Thank you for the things that you've done. The advice is great. And I always try to point out with them that, like this toll-free number I give out, 855-949-RADIO, I said, they're not doctors on the other end. You're not talking to doctors on the other end. They're not going to cure you, but what they are going to do is help you. They're going to give you information. They're going to steer you in directions that you can make up your own mind. And I'd like to tell people to talk to their own medical provider, but I got to tell you, even I did that once. And they really don't want to talk with you about other types of remedies. They don't like to hear it. Why is that?
Well, a big part of the reason, George, and this is what I have found working with doctors, very closely with doctors for all these years, many of them don't want to address those things, not so much because they know that if they turn someone on to a good vitamin and mineral complex, it's going to take that person out of their practice. It has more to do with the fact that they do not understand nutrition. They do not understand the body's need for all these minerals and trace minerals, all these vitamins. They don't know, they don't understand, and rather than say, I'm really not sure about that, most of them have such an ego, they just say, oh, that's not anything that you need to concern yourself with, I'll take care of you, I'll make sure you get what you need. So from my perspective, it's because they don't know. And I've found that to be true in many cases because I've worked with doctors, and when they finally will sit down and listen to me, they will say, oh, my gosh, that makes so much sense.
Exactly. I once gave my doctor a study that obviously he didn't even know about until later. So stay with us. Dr. Joanne Conaway with us from criticalhealthnews.com. Phone number 855-949-7234. We'll be back with her more. Next hour, we'll take phone calls with her. And Joanne, let's talk a little bit about this study then that is telling people that chronic fatigue syndrome may be caused by a disease of gut bacteria. What does that mean?
Well, it's interesting, George, and I absolutely love talking about this subject because back in those early days, as I was talking about before, when people had a diagnosis of fibromyalgia or chronic fatigue syndrome, conventional medicine did not know what to do with them. And because the symptoms were so unusual, they classified it as an autoimmune condition. They recognized the immune system was out of control in some way, but they thought that it was probably all in their head. And it was so interesting because I can remember going to conventions back then and listening to the latest research and talking about how these people really need to go for that psych visit because their symptoms just are not falling into any specific category, so perhaps it's all in their head. Well, I've known for a long time that if you don't have a good, healthy gut microbiome, and what does that mean? That means if you don't have enough good, healthy gut bacteria, but you have too much of the unhealthy gut bacteria, you're likely to have issues and problems that are autoimmune, not because the immune system is in hyperdrive and overreacting, but because the immune function, the majority of immune function, actually is in the digestive system. 75 to 80% of our immunity is housed in our gut. And so when we hear something like this with a fibromyalgia, and it's interesting because most autoimmune diseases fall into the same category. Your scleroderma, multiple sclerosis, lupus, those things that are all autoimmune all have an inception in an unhealthy digestive system.
Do probiotics help, Joan?
Oh, yes, absolutely probiotics help. There are many things that help. The first thing that I tell people they need to do is clean up the diet. And what do I mean? Well, we've got to get those things out of our diet that are contributing to the destruction of the good, healthy gut bacteria. But then we also need to recognize that good, healthy gut bacteria does not get there until or unless we put it there. And we put it there with fermented foods or probiotics. Probiotics are a big deal these days, and the reason why is because so many people have an unhealthy gut. We give them probiotics and can literally turn their guts around, but beyond that, we can turn their health around.
You know what's amazing, though, when you talk about good bacteria and bad bacteria, I mean, are they truly different critters?
Oh, absolutely, and in a major way. When we talk about the good bacteria, the two primary ones that most people talk about are the lactobacillus strains of bacteria and the bifidobacteria. Those are the two primary types of bacteria. We have several strains of each type, but they are much different from what we call the bad bacteria. And the bad bacteria, there's something that we all have. Yeast, fungal yeast, candida yeast. It doesn't become bad until it's allowed to overgrow. And it doesn't overgrow until we kill off all the good, healthy gut bacteria. We kill off the good, healthy gut bacteria by eating genetically modified foods, by taking too many antibiotics, by taking too many steroids, by drinking water with chlorine in it. There are various different ways we kill off the good stuff. So, since the good stuff is easily killed off and the bad stuff not so easily killed off, the bad stuff begins to replicate and becomes more of an issue. For example, people have chronic systemic yeast infections. Those chronic systemic yeast infections that sometimes go years without being diagnosed all happen because you don't have enough of the lactobacillus and the bifidobacteria. You have an overgrowth of the yeast. And again, we all have it. Candida yeast is something that we all have. It's not a problem for us until it's allowed to overgrow, and then it becomes a problem.
And then it goes wild, doesn't it?
And a lot of things happen, George. It's interesting because when you look at the research that's been done, and this is fascinating research for me. This is my area of expertise. I absolutely love this. But you look at the research that's been done over the last 20 or so years, and it's fascinating to find out what we've actually learned in terms of how those bad bacteria process our foods differently to the point where instead of yielding those molecular structures necessary to go out and do the job at the cellular level, they in fact yield poisons that leave the digestive system, and those poisons go out and they become toxins. And wherever they decide to take up housekeeping in the body, that's where you may have an issue. For example, they may take up housekeeping in the thyroid, and you may have a condition called Hashimoto's thyroiditis, a very popular condition, something that we hardly even talked about when I was in nursing school. But now it's become very prevalent. It's become so prevalent because of unhealthy digestive systems.
Joanne, let's talk about what people can start doing to better themselves. And you've talked about what they eat and, how to make sure that they are taking care of themselves, supplementing and things like that. You have to get into the mindset, too, though. That's important. Somebody has to be disciplined enough to say, I'm going to start doing this. I mean, I take an entire regimen of supplements and vitamins. I mean, for just about everything. And I gotta tell you, I haven't felt better. People tell me that I look 15 years younger than I did 10 years ago. I must be doing something right. And a lot of people that I've talked to about programs like this are doing the same thing. But isn't it discipline? How important is that?
Well, it's very important. And one of the things that we have an issue with, it kind of becomes a vicious cycle for many people because there are many things that influence how we function and take care of ourselves. You know, when we look at those things that are influences, the food, for example, whether or not we have good, healthy digestion, whether or not we supplement. But we take it one step further and look at the other things that influence us. You take supplements, and people may be critical of that. People are critical of me that I take supplements. Well, you know something? I'm a nurse for over 40 years, okay? So I'm no spring chicken. And yet I used to work nights, and I could work circles around the kids that were in their 20s and 30s. So I take my supplements. I feel good taking my supplements. I know that my supplements are benefiting me. But many people struggle. They struggle to get past that recognition and understanding because their doctor's not going to support that. And the media is not going to support that. When you look at any 6 o'clock news show or any other TV show that's in the evening hour, many of the commercials are for pharmaceuticals. And people are convinced that this is the way to make me well. I just have to go to my doctor and I have to get this pharmaceutical. And I tease when I lecture and I say, you know, if you sit down and you watch the evening news for 5 days in a row, you may be fine on Monday, but by Friday you certainly have something that we need to treat with a drug. Well, people are influenced by these things. So when it comes to more specifically answering your questions, people have to make a choice. They have to make the choice to decide to be well and to stay well. And so then we get into how can we do that? Well, first, you make a choice. And it's difficult for many people. Many people, and especially younger people, they've grown up with fast food. They've grown up with convenience food. They don't know how to prepare a meal from scratch. They don't know what it means when I say you shouldn't eat prepackaged and processed foods. In their lives, that's all there is prepackaged and processed foods. So we have to educate them and help them to know what they don't know and help them to understand how these foods are impacting their health and then help them understand what they can do. Then they make a choice. And yeah, it is a choice that needs to be made, but I don't think you can make a good choice about your health until or unless you have a good understanding about what you're doing that's making you unhealthy and what you can potentially do to make you healthy.
When you wrote the book, Why is America So Sick? What was it that you saw that made you decide, I'm going to write about this?
Well, if I may, I'll tell a personal story.
Okay.
It's my son, and he's now 23 years old, but when he was 2 years old, had a horrible ear infection and strep throat. It took 3 rounds of antibiotics to kill the infection.
Oh. Did they want to put tubes in his ears, too?
Oh, well, of course.
Uh-huh. Yeah.
But I knew enough to say, no, we're not going to do that, okay?
Good.
So, third course of antibiotics, he develops this horrible diarrhea, becomes very dehydrated. I knew enough at the time to get him some Lactobacillus acidophilus, which is one of those good, healthy gut bacteria, and I started giving it to him, and within 24 hours, the diarrhea had gone away, and his dehydration was much better, and things were okay. However, subsequent to that, he developed a horrible eczema. And this wasn't a mild case of eczema. This was a horrible eczema down his back, across his bum, behind his knees, his arms, his head, just horrible eczema. And for 8 years, he lived with that horrible eczema because his mother was too stubborn to let the doctors put him on steroids. I would not allow him to be put on steroids because I know steroids impact the adrenal glands. He already had some immune system issue. I didn't want to knock out the function of his adrenal glands.
Right,
and it wasn't until I sat down and talked with Dr. Wallach and another naturopathic friend of ours, we started talking about him. The line of questioning was something like, has he ever been on antibiotics? I explained what I had done, and I explained that I had given him lactobacillus, and they said to me, you only did part of what needed to be done. He also needs bifidobacterium strains, so this is a child who had not been eating wheat, because it was problematic. It would cause his eczema to get worse. He was lactose intolerant, would not eat any cheese or milk or anything like that. So I decided to do what they said. Let's get him on probiotics. Make sure he stays off all wheat, all dairy, get him on some probiotics. I got him on probiotics, and as God is my witness, within 3 days, his eczema was so much improved, I couldn't believe it. Within 5 days, it was gone, literally gone. This eczema he had lived with for 8 years was gone in 5 days. That just blew me away. So what I did was I then started to research, okay, so what made this happen? And that's how I got involved in gut health and the basic understanding of gut health and the recognition that taking good probiotics can actually help to repair the gut lining. This child is not lactose intolerant. He can eat ice cream, he can eat cheese, none of those things bother him anymore because his gut is now healthy.
Would you say that
it happen over and over again?
Would you say at this point you're an expert on that right now?
I say I'm an expert.
Good for you. So needed. So needed. We're with Dr.
Mostly because I've been able to help so many people.
Do you have like a private practice?
What I do is I do mostly phone consultation. With Critical Health News, we have, the whole way that's set up is I can sit in the comfort of my own home and I can do consults with people all day long and help them understand what they need and why they need to do what they need to do. It's fascinating because a lot of people think that it has to be so confusing and so complicated, and it's really not. When you stop and think about what happens at the cellular level in the human body, if you have healthy nutrition and a healthy digestive system, it's not that complicated. For me, it's not complicated, and for me, I have the ability to help people understand why it's not so complicated, and they see a benefit. They see a difference. They get well.
What do you think of this incredible revolution with stem cells these days?
I think stem cells, personally, I have kind of followed stem cells off and on through the years, and I think stem cell therapy is amazing, and some of the things that we have been able to do with stem cells just kind of rocks the world, if you will. From my perspective, however, I would like to keep people from having to reach the point where they have to consider stem cell therapy. And from my perspective, knowing what I do, recognizing that the human body is a fantastic healing machine, you give it the raw materials it needs and it will heal itself, I think that that's where we need to start for many conditions, and oftentimes that's all it takes. I'm telling you, George, I can't tell you the number of people I've helped in 18 years just by making sure that they have good nutrition, making sure they understand what it means to clean up the diet, get rid of those bad foods, those foods that cause inflammation, those foods that destroy gut bacteria. Get those out of your life and fix your gut lining so that when you take these good nutritionals, they are well absorbed and you're boosting your immune system.
I get all kinds of emails during the week when a lot of members of the criticalhealthnews.com team are on, and so many people ask so many questions, Joanne, about their own health and their own issues. And I'm wondering, do they go to their practicing physician to ask them for help? What's happening there?
Well, sometimes they do, but I have to be honest, George, it's difficult sometimes to get in to see your practicing physician.
True.
And in many situations, you don't have a practicing physician anymore. This was one of the things that I struggled with when I finally left nursing. Patients were being admitted to the hospital, and their primary care practitioners no longer had privileges at the hospital. They could see a primary care practitioner in the office, but if they were admitted to the hospital, admitted through the emergency room, they were taken care of by a hospitalist. Now, I can't tell you what a struggle it was for some of these older people who had been with their docs for 20 and 30 years. They're admitted to the hospital. They want to see their doctor, but instead they see someone who is totally new to the field, and they don't know this patient at all. And so the patient can't identify with the doctor can't identify with the patient, and what makes it worse is that hospitalist that admitted them through the middle of the night, they may never see that same hospitalist again. They see other hospitalists that are on the hospitalist team, and so it's very difficult now for a person to, first of all, get an appointment with their primary care practitioner, and if they end up in the hospital, to ever see their primary care practitioner.
Right. And you may never get them on the phone.
That's true. That's true. And it's because doctors have become so busy. Why have doctors become so busy? Well, because people have become so sick. Why have people become so sick? Well, from my perspective, it has everything in the world to do with the environment that we live in.
And what about these new viruses that seem to keep popping up that we really didn't know about? Maybe they've been around for a while, but they were just lingering, like Zika now. Zika's the big virus that they talk about. It was SARS before this, and it was something else after that. But Zika's the big one now.
And, we had all of those things. And people, of course, people would come to me and they would be in panic mode because what do? I don't want to get it. I don't want to show up and be in a situation where I might be exposed. And they start wigging out, as I say, about these viruses that are coming down the pike. Why are we seeing so many more viruses? Well, there's a lot of theories around that, okay? But why are they affecting people? They're affecting people because their immune system is not healthy, and their immune system is not healthy because their gut is not healthy. We have so many products and so much available to us to keep the gut healthy and to boost immune function. People shouldn't have to worry about these things. But again, they have to be educated. And the education most people get is what they see on the television, and they, again, go into panic mode, and it takes a while for them to settle down enough where you can explain to them, if you keep yourself healthy, you don't have to worry about exposure to those viruses. I worked in the hospital for a long time. I was exposed to, I can't tell you how many things. I was not sick. I was not sick because I was healthy. I was healthy because I kept my immune system healthy, and I made sure that I followed the rules that we talk about in terms of good food, bad food, healthy digestion, 90 for life, all of those things that will keep us healthy. So, yes, lots of viruses. And, there was another article that came out, I think, just yesterday, talking about, again, the influx of people coming into this country that have tuberculosis.
Oh, well, yeah, which is coming right back again, isn't it? Vancouver, Canada, though. No, he's not ready. How about Dave in Pennsylvania? David, go ahead.
Hello?
There you go. Yes, sir.
Hi, David.
Yes, I've been listening to your program, and I was lucky I got through. Now, I'm in my elder age here. I'm in my 70s. But here recently, again, I was exposed to the herbicides here that the neighbor used, made me violently ill and everything else. It's not the first time here, and it probably won't be the last time, I guess, because I've been hit with Agent Orange and
oh my God,
gases and everything else. I lived to tell about it. But it's taken its toll on me. But one thing I found out, I'm retired now. I had my own medical foundation for 37 years, Porphyria Research Associates Foundation. I'm poor from metabolism of the liver, and I was involved in the Pittsburgh area of transplantation of the liver. I'm not MD. I'm a poor guy behind a test tube and a microscope. But I was able to find out now in diet here, this might be an important thing. All our vegetables and everything else are deficient in the natural minerals that we have. You can take a substitute of calcium, magnesium, so forth like that, but you're only absorbing about 1% of it. When I found out, I grind it up, and I cook in a crock pot. All my vegetables and everything else. And if I use potatoes, I skin it down to a quarter of an inch because diquat dibromide is in that potato from the ground, and it's a deadly herbicide.
That's
anyhow,
pretty smart.
I cooked everything down, the vegetables. After an hour of it cooking in this crock pot, I grind up all these here minerals, and I add them in. Now, my thing is that the vegetables in there, and now take those minerals in and make them organic again.
Yes.
And they absorb 100% or 1,000% more so than if you took a pill of it and swallowed it down or chewed it up there. So it's just a thing that I'd like to pass on. It's worked with me here, and it's a diet that I have to follow. And as I say, I found here, too, I used to eat meat, the burgers I used to buy. It was made out of beef hearts and other hearts. And soy added to it. But here recently I started getting small gallstones. So what I did, I figured, well, the soy now, they're made immune to the herbicides, the 2,4-D and Roundup.
Well, and some of the soy could be GMO also.
Absolutely.
And how do you know, Joanne? Because they don't label GMO foods, so how do we know poor David's not eating GMO soy?
Well, unfortunately, they don't label GMO foods, and I know that you know that that's a big controversy right now.
Huge.
Unless you buy a product that says non-GMO and non-GMO verified, you can't be guaranteed that it is non-GMO. Soy is one of those things, and 90% of the soy, 90% of the corn in this country is all genetically modified. So it's very difficult to get non-GMO soy. You have to really pay attention to what's on the label. But I think that his approach to getting minerals is an amazing approach. The thing that I would add to that, though, is with the longevity products, our mineral products are in the colloidal form and are far more readily absorbed in the digestive system than any of the elemental or chelated minerals that you find in products on a store shelf. So when you go for a mineral and you buy a mineral pill, to your point, that is not readily absorbed. However, when you use minerals that we have that are in the colloidal form, they are much more readily absorbed. So your approach is great because your vegetables are getting the benefit of those minerals once you've crushed up those pills and put those minerals into
he's being innovative, that's for
the way
sure.
you do it. Mm-hmm.
Let's go to Deb in Minnesota. Hi, Deb. You're up with us.
Hi, Deb.
Thank you so much for taking my call.
Sure.
After using an antibiotic and a diflucan to kill the yeast that it caused, I tested positive for group strep B on the culture, and I am allergic to penicillin, and so I wasn't able to take that, but I have had severe burning pain from the strep B for 5 weeks now, and I'm wondering if there's any kind of a natural cure for it, or if it can heal on its own in time with taking good probiotics and a no-sugar diet. And
ridding yourself off of so many antibiotics, which are, I think, pretty darn bad these days, Joanne.
Oh, absolutely. Oh, my gosh, yes. So, to answer your question, what I would say is, first of all, doing the probiotics is a great way to start because it's going to help to boost your immune system. But we also want to address the other issues, and inflammation is one of those issues. We have products in the line that can deal very nicely with that inflammation. So my recommendation to you would be to consider that 20-day program and then add to that the basic 90 nutrients. But in addition to the basic 90 nutrients, I think what you want to consider is extra of the essential fatty acids, because those essential fatty acids work very well to help with the inflammation. And anything that will help to decrease the inflammation is going to help to increase or decrease the irritation and the pain associated with it. But I would not say, yes, it's going to progressively heal itself over time. What I would say is you need to support and promote that healing, and you're going to do that by ensuring that the gut's working well, you're getting the 90 nutrients, and you're taking additional essential fatty acids to help with that inflammation.
Joanne, where do we get your book, Why is America So Sick?
Where do you get it?
Yeah.
You can get it by going out to Critical Health News. You can order it there, or you can go to my website, which is DR for doctor, so DRJ Conaway, CONAWAY, so drjconaway.com.
How about Amazon? Do they have it?
No, they don't have it yet, George.
Okay. Well, it's going to be a very popular book, and I want to thank you for your debut on Coast to Coast.
Well, thank you for having me. I've enjoyed it thoroughly.